How to cure gout at home by yourself. Briefly about the symptoms of gout. In addition to the symptoms typical for a cold, such as nasal congestion, discharge from the nose forward or backward, additional symptoms appear with gout. Usually, this is a feeling of distension behind the cheek in the area of the maxillary sinus. There may be a feeling of pressure in the area of the eye. There may be a pain syndrome in the area of the upper teeth. Also, be alert if the cold lasts longer than 7 days and the usual remedies for the cold do not help you. Guys, this video is for those who found themselves in an extreme situation. For example, you live in a small town or in a village, and for reasons including the pandemic and quarantine measures, the medical facility is closed and you do not have the opportunity to see an otolaryngologist, then you can use the recommendations that we will discuss with you today. However, if you do have access to an otolaryngologist and have the opportunity to see specialists, it's better to do so. If you do not have such an opportunity, you can start treatment according to the plan that we will now discuss with you. But if you have any feelings that you are getting worse or 2 or 3 days pass and it does not help, you must call for emergency medical assistance. At least they will take you to the local hospital where there might be an ear, nose and throat doctor. If they cannot provide you with qualified medical assistance there, they will definitely send you to a regional center where you will receive this assistance 100%. The most important thing you need to know is that the puffball mushroom has a spherical shape. But even more important information is that the sinus communicates with the nasal cavity through a window, so to speak. But this window is located at the top, and most often with sinusitis, this window is closed, blocked by swelling. This prevents oxygen from getting into the sinus, which has bactericidal properties and kills microbes. And this hinders the outflow. That is, it disrupts the removal of mucus and pus from the sinus, thereby exacerbating the inflammatory process. Therefore, our main task with sinusitis is to open this very window. And for this, we use a vasoconstrictor based on oxymetazoline or xylometazoline. We use a spray or drops. If it's a spray, it's sprayed into the nose with the head tilted forward. You hold the bottle vertically and spray 2 to 3 times to ensure the opening of this passage. If you bought drops, then there are slightly different rules here. We tilt our head back and lean to the side we are dropping into. And we drop on average 2, 3, 4 drops, but in such a way that there is a feeling that the drops are flowing down to the throat. I recommend my patients to drop vasoconstrictor drops on average 4 times a day. When the condition improves, you can reduce the frequency of use to 3 times a day. The second thing we need to do is to evacuate mucus and pus from the sinuses. We open the window with the help of decongestants, but the sinus, it opens upwards, and the pus itself will not come out from there, because the cilia, which usually clean the sinus, especially during a purulent inflammatory process, they do not work. And the pus simply stays in this sinus under the force of gravity and cannot come out of it in any way. But we are smart people with you. We know the laws of gravity. We know the force of gravity. And if we turn our mouths down in a certain way, then according to the laws of physics, the pus will start to flow out of the sinus. How can this be done? It's all very simple. Our head, the sinus, opens upwards. So if we put our head on the opposite side, the sinus will be in the lower part of the cavity, and the pus will start to flow out from there. But not always it starts to flow out on its own, and you can help it do this by creating a vacuum in the nasal passage. What needs to be done to create a vacuum? You pinch both nostrils and start inhaling air through your nose. However, because the nostrils are pinched, no air enters the nose. Thus, you create a negative pressure, which helps the mucus to start coming out of the sinuses. That is, you make such a movement, close your nose, and start to inhale. You pull like this for about 5 seconds, then give yourself time to breathe. Then you pull again for 5 seconds. Remember, you're doing all this while lying on your side. That is, your head is on the opposite side of your body. If you have a cold on the right side, then lie on your left side and perform such vacuum actions on your nasal passage. Start pulling in for 5 seconds and carry out this procedure for 5 seconds, then take a breath. And you need to do about 10 to 15 such vacuum actions for each nasal passage clean. Usually, after some time, the pus gradually begins to come out, so it is desirable to stay on this side for about 10 to 15 minutes. This contributes to the additional drainage of the maxillary sinus. It is desirable to perform such procedures 3 times a day for 3 to 5 days until discolored yellow or green mucus comes out. The next step that needs to be taken to successfully treat sinusitis is to reduce the antigenic load, that is, to rinse out excess microbes from the nasal cavity, especially after the procedure of evacuating pus from the nasal sinus. The immune system, when it sees a lot of microbes, works in such a way that it intensifies the discharge. Therefore, if we rinse the microbes from the nasal cavity, we will contribute to the reduction of the discharge, the sinus will work better, and you will recover from sinusitis faster. That's why it's necessary to rinse the nose safely. How can this be done? You can do this with the help of sprays with seawater, as I teach my patients, simply without any special technology. Just spray it into the nose and carefully blow it out. Secondly, you can use special systems, for example, a Leica from Aquamaris. You prepare a saline solution, pour it into the Leica, tilt your head down to the side and start pouring the solution from the upper nostril. The saline solution flows out from the lower one, thus cleaning the nasal passage without creating any special increased pressure. Half of the Leica went through one nostril, half of the Leica went through the other nostril. But if you don't have this device, there's no need to worry. You can try to rinse with a regular syringe. For example, pour 10 or 20 milliliters into a syringe of saline or a solution of sodium chloride 0.9%. Also, tilt your head down to the side. Try to pour the solution from the syringe into the upper nostril. It may come out of the lower nostril. It may come out of the same nostril. But after performing this procedure, we carefully blow our nose and clear it. It's very important not to create increased pressure in the nasal cavity when rinsing the nose. That is, it's preferable not to use sprays and systems that increase pressure because they can clean the nose more actively, agreed. But this can lead to the fact that mucus can get into the eustachian tubes, and this can ultimately lead to otitis media. Also, when blowing your nose after rinsing it, you need to do this very carefully, without significantly increasing the pressure, so as not to lead to the same otitis. You need to rinse your nose 3 times a day. If in the first few days you feel the need to do this more often, you can do it more often while observing safety conditions. The next thing we can do after we've cleaned the nose and drained the nasal sinuses is to use a local antibacterial agent. There aren't that many local antibiotic remedies for the nose. In Russia, you can buy Polydex or Isofra. But since these remedies are used uncontrollably and very often by patients according to incorrect treatment schemes, unfortunately, most microbes have developed resistance to these drugs. That is, they are insensitive to them. Therefore, we often use eardrops, local antibiotics, or eye drops, despite the fact that this is, for example, an ophthalmic drug that is instilled into the eyes. We can quite calmly instill it into the nasal cavity as well. Of course, this will be a prescription not according to the instructions, so-called off-label, but nevertheless, in some situations we simply have no other choice. But if you have not used isoflurane and Polydex in the last year, in recent years, then you can use these drugs. But for them to start working, I prescribe to adults not 1 dose as written in the instructions, but 2 to 3 doses in each nostril, 4 times a day without fail. And only then do these drugs work. We usually prescribe a course of treatment for 7 days. If you have been using these drugs recently, or they do not help you, in such cases I usually recommend eye drops, for example Albucid or Tobrex, good drops. From ear drops we like to prescribe, for example, Sofradex. This is a complex drug with antibacterial and anti-inflammatory effects, which works not only in the ear but also in the nasal cavity. We usually prescribe local antibiotics for about 5 to 7 days to completely cure the microbial flora that is present in the nasal cavity and sinuses, ultimately leading to recovery. We have already talked with you about how to open the window through which the maxillary sinus opens. But if the condition is minor, if the inflammation is strong, then not always vasoconstrictive agents cope. That's why we have a little stick crutch. These are intranasal glucocorticoids. The most popular names of these drugs are Nasonex, Avamis Desrinit, Nasobec, Budostertafen Momet. Of course, on the internet, if you start reading about them, you will find that usually these drugs are not used for acute sinusitis because they can reduce the work of the local immune system. But there are already several scientific papers, scientific articles about the fact that these drugs do not affect the work of the local immune system at all, and their anti-inflammatory effect gives much more benefit than this mythical effect on the local immune system. I prescribe these drugs 2 sprays in each nostril, twice a day for at least 10 days. If you have a high body temperature or you have a pronounced pain syndrome and painkillers do not help you. Also in those cases when you have followed all the prescriptions we discussed and you do not feel better after 2 or 3 days, usually these are all indications for prescribing systemic antibiotic therapy. That is, the use of antibiotics in tablets or the use of injections. You cannot prescribe these drugs to yourself, and pharmacies are unlikely to sell them to you without a prescription. Therefore, you go to the nearest specialist, to a general practitioner, or to a therapist, or to a field doctor who is definitely within a radius of 50 kilometers from you. Tell about your problem and choose an antibiotic. The most important thing you need to know is that we start treatment, as a rule, with penicillin protected in a dosage for adults 1000 milligrams twice a day. If you are allergic to penicillins or have other contraindications, we usually use macrolides and most often clarithromycin in a dosage of 500 milligrams twice a day for adults. If we use cephalosporins, it's better to use them in the form of injections, for example, the drug ceftriaxone at 1 gram twice a day. Friends, I remind you again that sinusitis is not a joke. There may be pus in the head, which can lead to serious complications. Therefore, if you have the opportunity to see an otolaryngologist, take advantage of this opportunity immediately. Write in the comments, how did you treat or how are you treating sinusitis? And what remedies are helping you? And what recommendations and treatment methods turned out to be useless for you? If you haven't subscribed to my channel yet, be sure to subscribe. There is still a lot of useful and interesting information ahead of you. I talk about how to boost immunity, how to properly treat a cold, how to effectively treat ear, throat, and nose diseases. If you've caught a cold and can't seem to shake it off, check out this video. If you're bothered by constant dryness in your nose, check out this video. Have a good day, everyone. See you later.